Hi, Dr. Sakthivel. How are you?
I'm good, ma'am. I'm good.
Okay, it's really a honor to introduce you. So, I mean, if I go on introducing you with your profile, I think the session will end with only the introduction of you. So, with so much of honors and graduating from all prestigious institutions from India and getting some good fellowships from abroad, I think he was the first to start up a full endocrinology clinic in Tiruchirappalli. And what I would like to highlight here is some of his qualities which make him set him apart from the rest of the crowd. So his the way of looking at his practice in the artistic way, the holistic way, and whatever he does it in full. So maybe that is something which sets him apart. I think God has gifted him with so much of good qualities and creativity. So now he's not only a clinician, but he has very good, artistic skills. The way he runs his clinic is something really to be admired. Another important thing which sets the stage for today's session is he started much earlier his research on the unhidden, or the hidden causes for diabetes. Like I think his study in his DM was on bisphenol and childhood cancers. Childhood obesity, which is something which was very important. And we have been looking at diabetes in different ways. But today, I think Dr. Shaktivel will unveil or give an opening or set the stage for some of the unhidden causes for diabetes, which is like an elephant in the room, and we are not seeing it. So, without much delays, the floor is open to you, Dr. Shaktivel. Please go ahead.
Thank you so much, ma'am. Can you hear me? Yes? Shruti? Can you hear me, Shruti? Yeah. So,
Yeah, you're audible.
Yeah. Thanks for the warm introduction, ma'am, and it's a pleasure to be here. Uh, this is a talk which I had given recently, and I think I had shared it with the PAN members, and then they said, "Why don't you talk it to our crowd also?" So that is how this talk has evolved. So thanks for having me here. At the outset, my PowerPoint isn't working, so I asked Shruti to be my by runner, meaning she will be doing the slides and I will be doing the talk. So are we ready to go, Shruti? Fine. Fine. So I think this is we need to go 12 more slides. I think this is the 12th slide, Shruti. This is page number 13. We need to go to page number 1. No, you're going on the other side.
Okay, 1 second. Oh, I was looking at this. Okay.
The same thing was put in 2 places.
Okay.
Okay. So yeah, so I was saying thanks for having me here, and this is being an endocrinologist. We usually know that the endocrinologists are more known for treating diabetes. My practice is mostly about hardcore endocrinology. I do see diabetes, but my main passion is about the hormones setup as such. So when I came across this topic, when it was given to me during my DM thesis time, the topic given was in childhood obesity, do plastics have a role? That was the thesis given to me, and we did a paper on that. We'll talk about it later. But that is the first incidence where I came to know about, okay, there are other aspects of metabolic disorders which we also need to look into. And that is how this talk evolved. And the talk is titled The Elephant in the Room, because we always talk about diabetes being so prevalent. About 1 in 10 people have diabetes. The most important cause is diet and physical activity. It's because of hereditary and so on and so forth. I wanted to give a fresh perspective on diabetes, a thing which we are actually not noticing, but it is just right there and it's very evident right before our face. And that is called the elephant in the room. Next slide, please.
Yeah.
Can I have a slide change? So let us keep it interactive. We can go to the chat session. And can you answer me in 1 word or in 2 words, answer to this question? Which is the most important cause of diabetes in today's world? In the chat section, please.
I can help you with the answers, Dr. Shaktivel. Yeah.
I can see that, ma'am. Yeah. Okay, I see inactivity, I see lifestyle, lifestyle, lifestyle. Okay, good, lifestyle. Now, when you mean lifestyle, what we commonly mean are the 6 pillars like diet, exercise, sometimes emotion, relationship, sleep, and so on, obesity and lifestyle. So this is the conventional teaching which has been given to us for many decades now. The most common cause of diabetes is diet and so on. So next slide, please. Okay, so this is the conventional thought. I think all these are covered here. When people said being sedentary, excess food, obesity, stress, family history, increasing age, diabetes, the most common causes. Now, next slide, please. And also the other things like how this leads to insulin resistance and how insulin resistance then leads to other disorders like blah, 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 PCOS, inflammation of the liver, atherosclerosis, hypertension, and so on and so forth. So this is the conventional thought that we are taught that diabetes is like a disease, and this disease is because of so and so causes, and because of this it leads to this problem, and this problem leads to complications. Next. But I would like to take a different perspective on what would be cause of not only diabetes, but a lot of metabolic disorders in today's world. But before we go into this, we need to look back into the past as to how far we have arrived. From way back in the about 3000 BC to the current generation, we've seen that medicine has crossed different cultures, right? From the Egyptians, the Babylonians, the Chinese, the Indians, the Romans, Arabic, and then finally the modern medicine. Next. But my question is, this talk is mainly it is mainly based to make you think about a little bit more about to question your own belief system, to question your own conventional thinking process. Are we fighting with outdated weapons? Because I think the enemy has evolved, but we are still thinking the enemy is still the same old person, and we are trying to fight it with just sticks and daggers. Next. So the question is, we see that diabetes is increasing with every year, and we are bringing in a lot of tablets, right from a 1 rupee tablet. Now we have gone up to a 10,000 rupee tablet, and still we are losing the battle. So why is it that we are losing the battle? That is the crux of today's talk. And I would like to shift you back to around 22 years back, that is to 2003, which is a watershed moment in the history of human diseases and disorders. So what was that that happened in 2003? Apart from people who are from community medicine, as someone there who can tell me as what happened exactly in 2003, which was very different in the history of medicine to mankind. I will look into your, no, don't like, yeah, you can post your answers here on the chat box as to why I say that 2003 is a watershed moment in medical history. Any idea? You have a clue over here, but still, if you want to, you can put it on in the chat box. Whatever you think could be the reason. I'm not here to judge anyone. I'm just here to say that there are certain aspects which we are missing right now, and we tend to follow what our peers also follow just because we think that because of this thing called the FOMO, the fear of missing out, or probably if we think different, maybe people will think bad about us. So the major the idea that I'm trying to say here is sometimes we need to question what has been taught to us. So yeah, 2003, a watershed moment in medical history. Why do I say that? Any answers to that? Someone wants to talk or wants to chat? I need at least one person to tell me why do they think it could be a guess. Okay, there's one from Shubha who says it could be the human genome project. Okay, could be, but what I'm trying to say here is regarding metabolic disorders. Anyone else wants to make a guess? Okay, so 2003 is the year when the number of deaths because of non-communicable diseases increased more than the number of deaths due to communicable diseases. So if you can see in the 1990s, the most common cause of death were all diseases because of infections like diarrhea, tuberculosis, respiratory infection, and so on. From 2003 onwards, the number of deaths in mankind has been because of non-communicable diseases, like, for example, heart attacks, cancers, accidents, and so on, rather than communicable diseases. Now, why is this a watershed moment? Because if you look into the history of medicine, as I said, different types of Arabic, Indian, Chinese, and so on, modern medicine became strong only during the era of infections, which is basically from the 17th century till 2023, which means that when modern medicine became strong because we were able to find out organisms, because we invented microscopes, we were able to see microbes, we understood that there is a bacteria which was there, which was causing the problem. We then discovered antibiotics, we killed the bacteria, and therefore we were very successful than other schools of medicine. And that is why our schooling system, our medical schooling system places a lot of emphasis on history taking for infections, and our treatment methodology is all based on infections and infection related medical management. Now, the problem here is from 2003, the most common cause of death is not infection. But even now, after 22 years, our history taking, everything is more towards an infection-based medical history and infection-based medical treatment. For example, if someone comes to you for a consultation, we have a table, we have a chair, we have one doctor seated over there. The patient hardly speaks, then the doctor takes some history, does some examination and makes a diagnosis and then gives a prescription. Now, this is a classical infection-based type of a medical treatment, because we think, or we have been taught to think, that most of the causes of problems are because of infections. But if you're going to think about it as a non-communicable disease, then our approach should be entirely different. That's what I'm trying to say here. Next slide, please. So from the 17th century to the 20th century, we won the battle against plague, against tuberculosis, polio, and so on, because we were very good with microbes. But we are failing now because this war is not against microorganisms. We have won the microbiology war. The war now is into the biochemistry zone, but we are still trying to fight it as a microbiology war. So we are using the same principles and strategies that we apply to microbes to biochemicals. And that is why we are failing. Next. Our history taking medical examinations are all tailored for infections. But we are now only able to tackle the biochemical changes in the body only when they lead to an infection, because we need to treat infections, or otherwise we go for transplants. We are not talking about metabolic disorders, how to get into the root cause of the metabolic disorder and change it. We are rather interested only into the final result, how to change the result. So we aren't fighting a microbe war anymore. We are fighting a biochemical war now, and therefore we need to change our thinking and our tools. So that is what I'm saying as the elephant in the room. And there is an elephant in the room. The only question is, are we seeing it? Next. So when I talk about the elephant in the room, there are 2-3 aspects that I wanted to talk about. One is about the concept called epigenetics. The second is about exposomes. And third is about endocrine disrupting chemicals. So the 3 E's. So what is this epigenetics? We have always been taught that diabetes is usually hereditary. My father had diabetes and therefore I have diabetes. Now, the entire concept of diabetes being hereditary is being challenged by this concept called epigenetics. So epigenetics, what they mean is that the environment can modify genes. For example, if I say I am a dark skinned person, suppose I migrate to Europe and I start living in Finland. After 2-3 generations, my great grandchildren might have a fairer skin. So how did my gene change? That is what is called epigenetics, because your environment can affect your genes because of some tweaks which they can make into your DNA. So this is called epigenetics. Basically, epigenetics are biochemical markers placed on top of the DNA to control which genes are switched on and which genes are switched off. So these biological markers are being influenced by your environment. And this is a very, very important thing, because now it puts the emphasis that problems, the non-communicable disorders are not because of hereditary, but it's because of your environment. Next. So epigenetics, meaning what happens to your DNA is that small chemical reactions happen, like DNA methylation, histone modification, or addition or subtraction of enzymes leading to switch on, switch off phenomena. Next one. For example, so these are some epigenetic modifications in the human pancreatic islets. And what happens because of these epigenetic modifications? It leads to type 2 diabetes. So your environment can lead to changes in your genes and gene expression, not in the gene per se. And because of the difference in the gene expression, it can lead to metabolic disorders. Next. So when we talk about diabetes, the diabetes is only a small part of this iceberg, because what is most important is hidden below, and that is your epigenetic alterations. Because of your lifestyle, there are some changes that occur in your genes, and because of this leads to metabolic disorders leading to insulin resistance, pancreatic islet insulin secretion deficiency or resistance, and finally diabetes. So this idea of an environment-induced epigenetic changes, a stochastic epigenetic change, and a heritable epigenetic change, all these coming together to produce diabetes, is something that we need also to consider. Next. We'll skip this. Next. This is a very famous experiment about epigenetics that was done. This is called the agouti yellow mouse model. Now, what they did is, when they started feeding a pregnant yellow mouse with a specific type of food, it led to offsprings with a specific color. So they were able to prove through this that because of change in the environment of the mouse, the expression of the future generation was changed. And this is how the epigenetics came to be established. This is the famous agouti yellow mouse model for epigenetics. Next. The second concept is called exposomes, which means the totality of environmental influences and exposures and individual experiences throughout their life. And therefore, because of this, how these factors interact with this genetic susceptibility to impact health outcomes and disease development is called exposome. So exposome could be right from the time that the fetus is formed till throughout the cycle, the life cycle of the human being. What are the exposures that the child has and how these can lead to disorders? So it could be chemicals, psychosocial, everything put together, right from an external exposome, also specific external as well as general external, and also internal exposomes. Next. So a good resource material to know more about this, which is environmental exposure leading to a metabolic disorder, is given in by the Endocrine Society along with IPEN, came up with this beautiful article in February 2024. This is called the Endocrine Disrupting Chemicals, Threats to Human Health, like pesticides, plastics, and forever chemicals and beyond. This is a good resource material. So if someone is interested to know more about this, you can read this topic. Next one. I'm coming to the crux of today's talk, which is the third one, which I said is EDC, endocrine disrupting chemicals, which means because of chemical exposures in your environment, these chemicals can then get into your body and they can make a change in the way the hormones signal. After all, hormones are also biochemicals. It is a biochemical signaling process. So if you get another chemical from outside, the internal biochemical signaling process can have a crosstalk, can lead to a different type of gene expression and a different type of hormone production. So that is what happens whenever you have a chemical exposure to a biological person. So this leads to something called the endocrine disrupting chemical effect. And we have shown here like how these interfere. These can interfere with all aspects of how a hormone acts, right from the receptor level to the expression of the hormone. Next. So here they've shown there are about 10 or more ways by which a chemical can get into your body and thereby change the way your hormones signal, right from the agonist to the antagonist to the receptor expression, signal transduction, epigenetic alteration, hormone synthesis, transport, distribution, breakdown, and throughout. So chemicals from outside can lead to changes in your hormone production, thereby leading to insulin resistance as well. Next. So why we need to talk about this is because a lot of times when we talk about chemicals, we always used to use the Paracelsus equation, which is anything which is measurable has to be beyond a point to become toxic. But this is something which endocrine disrupting chemicals do not adhere to, which means there is no regulatory acceptable level of an endocrine disrupting chemical, which means the mere presence of it itself is abnormal. So this is something which we need to know, because most of the times when we try to tell something is toxic or not good, we always try to have an acceptable level of exposure. This does not happen for these type of chemicals. Next. So this is a simple graph from the Americas of the 1940s to the 2010s. And this graph shows about chemical production in the US. That is the blue line. And then the red line shows about the diabetes prevalence in the US. Okay. And I think there's nothing else to be spoken about here. You can see how congruent these two lines are as the chemical exposures increase, the incidence and prevalence of diabetes is also increasing. Now, when we talk about diabetes, we always talk about diet, physical activity, and sleep. But what if your diet was laced with chemicals? What with the time when you are sleeping, you are exposed to chemical exposures? We never talk about some things which we have never measured or we do not know how to measure. So the intangible factor, it could be the one of the most important reasons why we have this so many changes, biochemical changes right now. Next. So this is again from the referral resource material which I have given you. Since 2009, the Endocrine Society's inaugural statement, they have always said that chemicals tested at dosages that individually have no observable effect can cause endocrine disruption when combined. And that it is important that decision about regulation of chemicals be based upon the most modern scientific understanding of how hormones act, not about the previous thought of having a measurable level, so that beyond a measurable level or an acceptable level is when it becomes very toxic. So we need to rethink and then re-challenge our own thoughts as to, because the chemicals do not adhere to the principles of science which we were taught. Next. So this is from, if you are going to think, okay, this is endocrine disrupting chemicals and all are very rare things. How are we going to get exposure to these things? This is 2020, about 5 years back, a paper from Coimbatore, where they looked into why farmers in the Coimbatore area were getting a lot of diabetes. And therefore, they did a study and they found out, and this is in Erode districts where the Bamani River flows. And they found out an association of arsenic and organophosphate insecticide, which is the insecticide has organophosphate and arsenic is more from the water and the soil, because the iron tubes have arsenic there. So the arsenic and the organophosphate have a potent combination, and this leads to insulin resistance. Okay, so this is a paper again and again presented by Dr. Krishnan Swaminathan sir and co. And they've done this study not only from Erode, they've again repeated the study in Coimbatore, in other areas, and they found it repeatedly that this association of arsenic with organophosphate insecticides leads to a lot of diabetes and atherosclerosis in the farmer community in Tamil Nadu. Next. So when we talk about chemicals, because they are going to be microplastics, we still haven't had a way to actually measure them. We still do not have much regulations as to how to screen them. Next. So they might seem very innocent because we use them in our day-to-day lives, right? From the cosmetics to our clothing, to our sofa covers, to the pizza boxes. all of them contain chemicals which may be the cause for most of our metabolic disorders. Next. So we need to know about hormones and endocrine disrupting chemicals. The most important things are these chemicals can affect most organs, and they have properties which are very different from the properties which we have been taught how chemicals act. Next. So the 5 W's of endocrine disrupting chemicals from the Hormone Health Network are what are endocrine disrupting chemicals? Second is, why should I be concerned about endocrine chemicals? And this was in 2013. And they said that endocrine disrupting chemicals, there are more than about 1,000 chemicals, and these can lead to a lot of disorders, including cancers, fertility. Have you ever thought why in the last 20 years, cancer hospitals, diabetes hospitals, and fertility centers have mushroomed? If you look into it, only these three have mushroomed a lot: cancer, fertility, and diabetes and thyroid. And if you are, and how do you put a common thread with all these three? You might say it is lifestyle. Now, when you say lifestyle, you think it's only food. But what if the food also had an extra element which is chemical laced, which is basically chemical exposures? Next. And what are the problems which can be affected or can be caused by these endocrine disrupting chemicals? As I said, they can affect any aspect. They can lead to a response to stress, leading to neurological and behavioral changes. They can lead to metabolic problems, which is diabetes, thyroid, PCOS. They can lead to reproductive problems like fertility, and they can also lead to growth and developmental disorders like weakened immune system and so on. So basically, most of the common modern problems, medical problems which we face, can be caused by this single aspect. Next. So when we talk about endocrine disrupting chemicals, especially when you're talking about metabolic disorders, the most common metabolic disorders that we come across are right now thyroid, diabetes, and then PCOS. And all these three can be connected by these chemicals. Next. So obesity, yes, it can be caused because of these chemicals. Diabetes, yes. Cardiovascular problem, a lot of heart disorders, why people are dying young, why they have a sudden cardiac death, could also be related to chemical exposures. So you need to understand endocrine disrupting chemicals. Same endocrine disrupting chemical can work at a low potency in one organ, but it can have a high potency in another organ. For example, BPA has low potency when measured in the liver and uterus, but it has high potency when measured in the brain and the breast. So these type of chemicals are very different. They work differently in different organs, and they do not have any particular acceptable cutoff level also. So potency, so the level of the idea of how to measure it is still to be quantified. Second thing is, even low doses matter. As I said, everyday exposure can contribute to modern health epidemics. And you can see here, it is found in children's toy, it is found in plastic drinking bottles, cleaning products, house dust, home furniture, building material, fragrances, food, cash registers, and personal care products. So very, very innocuous and very, very innocent looking products can have chemicals. And if you look into that, all the red dots which they have shown here, they are the most common things that we come across today, like ADHD, autism, asthma, obesity, early puberty, breast cancer, low birth weight, diabetes, obesity, infertility, and cancers and thyroid disorders. The most common things that we come across today, all of them can be caused by these. Next. So the top 5 endocrine disrupting chemicals are bisphenol A, phthalates, PFAs, dioxins, and flame retardants. And they are found in they're almost ubiquitous, and they are found all across in our environment. Next. Now, how do these endocrine disruptors act? As I said, they have different methods, more than 10 methods by which they can act. They can act like hormones, or they can mimic the body's hormone levels, or alter the body's natural production of hormones. We might think it is the hormone, but we do not look into what triggers the hormones. Next. So exposures, again, endocrine disrupting chemical exposure can be while the baby is in the mother's womb, or it could be even just after birth. So depending upon the exposure, the concept of exposome, that is why I spoke about the concept of exposome, where it means that the timing of endocrine exposure leads to different types of metabolic disorders and other aspects of medical health. This is my paper, which is my thesis about urinary level of endocrine disrupting chemicals in obese and non-obese Indian children. So this was in 2012 to 14. This was the first paper from India where we looked into obese children. This was in Kerala. So obese children between 5 years to 12 years, we took their urine samples and we took non-obese children and got their urine sample and sent both to the US to look for biochemical exposures in their urine. Kerala is said to be green. Kerala is said to be more organic. So one of the better states, we took this test about 12 years back and sent it to US. And the results were both the cases as well as the controls had more than 3 times the allowed exposures of chemicals. The only thing is these people, the obese children have manifested as obesity. Whereas the non-obese people, they still have higher levels of EDCs. They might manifest later with infertility or cancer or something else. So the only thing is right now they have not manifested as obesity. Probably they will manifest some in the later as something else. But all of them are alarmingly high levels of endocrine disrupting chemicals. And this was in Kerala and this was 12 years back. Then think about the other states and the current situation. So bisphenol A, which was my chemical which was to be considered, can affect by binding and interfering with biological receptors. It can interact with transcription factors and it can lead to epigenetic modifications. Next. And all of these could lead to obesity and diabetes. Now, having said that, let us look into the positive side of who are the people who are trying to change the way we think about diabetes. I'll leave you with 3 people whom were very influential in my understanding of diabetes. The first one is, next, Dr. Leonardo Trasande from the US. He is the one who first spoke about endocrine disrupting chemicals and childhood obesity. One of the first papers were from Trasande. This is his book, Sicker, Fatter, Poorer. It's available on Amazon. So you can go through the book and it talks about how things have been and what are the regulatory authorities have looked into, what they have not looked into from the biochemical perspective. And Trasande also made a paper from India, Unlocking India's Potential in Managing Endocrine Disrupting Chemicals, Importance, Challenges and Opportunities. This was in 2022. So he had also looked into what are the aspects and problems right now in India, and he had also given solutions to that. Next. This is again a hypothetical model of how early phenotype induced by bisphenol A may contribute to metabolic alterations later in life. Like, for example, plastic exposures can lead to fatty liver, insulin resistance, dyslipidemia later in life. Next. And this is Trasande's paper where the green box shows essentials for effective endocrine disrupting management, which is modern chemical regulations. We have to change the rules, systematic monitoring of these chemicals, waste management capacity and infrastructure, public-private partnership, and public awareness. The second person is Dr. Sheila Satyanarayana. She's a pediatrician from Seattle Children's Hospital, Seattle, US, and also an environmental epidemiologist. And she is focused on how endocrine disrupting chemical exposures in the perinatal, like while in the mother's womb, and early childhood later affects children, leading to metabolic disorders. So endocrine disrupting chemicals can affect not only in a adult but also while the person is pregnant, and right from the early exposure it can lead to other problems when the child grows up. Next. And the third one is from Tamil Nadu, Dr. Krishnan Swaminathan, again an endocrinologist. He spoke about pesticides and human diabetes. He did a pilot project to explore the possible link, and there was a link which he established between pesticides, arsenic, and human diabetes. This was in 2015, by the way. And these are all his papers about gut microbiome, endocrine disrupting chemicals, and diabetes. Pesticides and diabetes. Metals in urine and diabetes. So all of them are not from any other country. They are from India, mostly from Coimbatore, Erode, and most of the fertile parts of northwest in Tamil Nadu. So this is a schematic summary of the molecular mechanism behind gut microbiome mediated organophosphorus induced glucose intolerance, which means Because of the organophosphorus chemicals, the gut microbiomes can be affected, leading to insulin resistance. So rather than looking into whatever has been taught to us alone, we need to look into possible ways by which our day-to-day changes can be done. For example, next, we need to look into our daily kitchens. We need to look into our daily utensils. Next. Because what we think as innocuous kitchenware could be formaldehyde, triclosan, phosphates, glycol ether, and phthalates. How many of us know how to buy a stainless steel kitchen vessel? When you go and buy a kitchen vessel, do you make sure that are we buying the right type of vessel? How do we know how to make the judgment as to which one is a good vessel? Next. So the premium stainless steel should have 18 by 8 food grade stainless steel. So I went to most of the kitchen vessel stores in my place. I also called up Salem because Salem has a stainless steel plant over there. And then I inquired to them about what is this 18.8. So 18.8 is about chromium and nickel. This is the alloy which is used to make stainless steel. And nickel should be at least more than 8 so that it is anti-corrosive. So only if you have a good 18 by 8 or 18 by 10 type of stainless steel, then only that type of stainless steel is good for consumption, for food consumption. Next. So this is about a closer look on stainless steel, about the chromium and nickel percentages. 18 by 10 is the one which is recommended, which is rust resistant, holes polish, highest quality, used for silverware. But 18 by 8 or 18 by 0 is what we get in most of the Indian shops. So we need to know about these things. Second is about what are the foods that contain lead, cadmium, uranium, and arsenic. And you see a lot of very tempting, innocuous food here. Other important thing is about the use and throw water bottles that we use. And there was a study in 2024 which said that, and these were from water bottles of good quality, like Aquafina and Coca-Cola use and throw plastic bottles. They found a 250,000 nanoplastic particles in a single plastic bottle of water. And the average is, they say, about 345 microplastics for every 1 liter of this type of water bottle that you drink. You consume 345 microplastics, and a human on an average consumes around 10 kilos of microplastics in his lifetime. And again, when we're talking about dishwashers and detergents, again, there's a suspected role of endocrine disruptors. That list is given in this website, which is chemtrust.org. So if you're interested, you can also log into this chemtrust.org. Endocrine disruptors and dishwashers, what are the ingredients? So this is a good resource material. So the food for thought, the thing that I want to talk about is that, yes. Next, please. The swaps that we can do. So we need to be more mindful whether how can we avoid plastics, avoid Teflon wherever it is possible. I'm not saying you can avoid plastics together, but at least you can avoid use and throw plastics. Avoid paper receipts and avoid plastic food storages and makeup with toxic chemicals, shampoo, body wash with parabens and toxic chemicals, and so on. Next. So back to more organic ways of looking into not only the food, but also your cosmetics. And how can I reduce plastics? Again, these are some swaps. Bring your own bottle, avoid unnecessary packaging, opt for fully recyclable packaging, use reusable cups, choose a tap water instead of a bottled water if possible, bring your own lunch box, bring your own bags, cook at home instead of ordering takeaways, and dispose of plastic recycling correctly. This is the resource which I said, ChemTrust, and they have given also a list about fertility, diabetes, and other health impacts, endocrine disruptors. Next. So the recommendations are, this is the slide which you need to know, that pregnant women should especially avoid contact and inhalation of chemicals, Children should be protected from chemical insult. One should avoid consumption of chemical contaminated food and water. Plastics, nonylphenols, phenols, petroleum products, and industrial fluids should not be burned. Use of hot drinks such as tea and coffee in plastic cups should be avoided since plasticizers bleach into the fluid when warm. Warm milk should not be served in plastic bottles. Use of glassware is recommended for consumption of warm food and drinks. Warm pudding and similar food should not be served in plastic cups and plates. Direct dermal contact to EDC should be avoided, and individuals should not swim in contaminated water. Next. So there's a list of things that they are given here. Recommendations for policymakers for prevention of EDC exposure, right from contamination of rivers, lakes to drinking water to consumption of fish, meat, poultry products, milk products, to agriculture and so on. Next. So we cannot solve our problems with the same thinking we used when we created them, said this great man Albert Einstein. I leave you with that because I think we are still harping with the old school of thought that diabetes is because of hereditary, diabetes is because of only diet. Yes, diet plays a role, but apart from diet, we should also look into things which we are right now not even considering, which is the elephant in the room. Next. So this is a questionnaire which I try to develop on my own, trying to put up all these things together as to if a person comes to me for diabetes. That is what I was trying to say. When you're talking about diabetes, when you take medical history, what we ask them whether your mother and father has diabetes, your children, we put a family tree asking how many people have diabetes. And then what do? You never ask about food and water, chemical exposures. You don't ask about home and environment chemical exposures, plastic exposures. Next, you don't talk about plastic toys. You don't talk about plastic bottles, about travel and recreation, whether they have traveled by air frequently, about toxic chemical exposures, about personal care products, and so on. Next. And also about other ways by which endocrine disrupting chemicals, or whether they have an awareness about endocrine disrupting chemicals and so on. So this is a small history which I tried to make on my own with about 35 questions, and we thought we'd have it as yes, no, and sometimes in the past, and try to get a score. Once we get a score, we'll know whether what is the possibility of this person having exposure to them, whether it's below average, average, good, or how are they doing as far as the awareness is concerned. These things I think should be inculcated into our diabetes practice, that apart from taking the normal history, we should also take into chemical exposure history. Of course, this is not a validated questionnaire, and that was what I was talking to CMC Vellore, to doctors over there, Dr. Hansdack and his unit. We were talking about, can this be made more into a validated questionnaire which can be then used even for normal diabetes practice. Next. So the elephant in the room is real. It's high time that we look for the elephant and we make the necessary corrections so that we don't stop being outdated and start doing something which is more fruitful. Thank you. Thank you so much for having me.
Thank you so much for that very much useful and eye-opening session, and making us feel that it's the elephant in the room is real. Thank you so much, Dr. Sakthivel. There are some few questions I think people are curious to know. I'll just sum it up. Like one is, what is the day-to-day? We use some milk packets and so many other things come in packets. So what about that? The question is open. It is an open question which is asked on that aspect.
Ma'am, as I said, some of them have to be at the level of regulations. Some of them have to be at the level of implementations. Only certain things we can do on our own.
Yes.
But the first thing is the awareness.
Yeah, true.
The awareness as to, okay,
Yeah.
this is also a possibility. So then only then we can get into regulations as to how do we look into those things.
Yeah. So Actually, even I'm also curious about this, being from an academic and an research institution, and somebody else also wants this questionnaire. Can we? I think it is high time this questionnaire needs to be validated and put into use. It is really important to understand these exposures and make people, understand the importance of knowing this. So, somebody also wants this questionnaire, and can you highlight on this and how we can go about validating and getting to put this questionnaire to better use?
Yeah, ma'am, you can share those 3 pages to them, because I think I do not have the PDF of it. I will put it in the group if required. But the idea is, this is not a validated question. This is a question which I
Yeah.
just made it up. I think if you all can come together and make it even more precise, rather than 25 questions, if we can make it less, that would be also great. But the idea is, this is not only for diabetes. This is even for cancer. This is for even for PCOS. It's also for infertility. So the moment you go to these places and people ask you about this, only then people will have an awareness. Okay, oh, so we should also think about these things. So unless we are going to talk about these things, people are not going to know.
Yeah, true. At least when we ask a question, they may ask, this may be a risk factor, like asking them, have you have a family history? Have you have a sedentary lifestyle? Do you have, junk food intake? Similar to that, they should also be asked about these things. That's what is at the clinic level, at least at the, when they come to the OPD, they need to be asked these questions,
Yeah.
right?
Yeah, so that's the first thing that I was thinking. I have a questionnaire which is validated. One, there's a question which I see by Dr. Sandhya Ravi saying that this is very difficult to detect changes at the community level or individual level, but most of these are policy issues.
Yeah.
Now, that is the easy way of saying I cannot do anything about it. But the hard way is someone has to do something about it. So we start if we have not started yet, we have to start somewhere. So we start somewhere, start with a validated questionnaire, and then use these questionnaires, then present papers on them. And once we have enough evidence on them, then go to the regulatory authorities with them, and then make policy changes. So that is how I think we need to move forward. But the most important part I'm trying to say, this is not about diabetes at all. It is about your infertility. It is about cancers, and it's about the other metabolic disorders also. So there's a common thread for all the most prevalent hospitals right now. And this thread is not at all being considered. Nobody's looking into this at all. So that is what I'm trying to
Yes.
put here.
True. Dr. Parameshwari also has shared about the problem in Kerala about the diabetes and the cancers due to pesticides, heart diseases due to other risk factors which we all know, stress, suicide rates, and other non-communicable diseases like RTA are high in Kerala. Is what she has shared. And what I would like to say is, instead of looking at only the policy changes from our level, I think some of us already are into making conscious decisions in our day-to-day life. We can spread this awareness to our friends, family, and our patients, and that may have a ripple effect and take influence policy decisions in the near future as well. Is what I'm also thinking.
Yeah, but my question is, if you're going to leave it as a awareness thing, then it will go in the air as only awareness.
Yeah.
It should
Yes.
be implemented in your daily practice as a questionnaire.
Yes. Yeah, true. And it should also improve our day-to-day practices. Like, for example, today I learned that whenever I go to a stainless steel shop, I should look at what is the proportion that is there. So that awareness I've got. So if I immediately put that into practice, and small changes make a big impact. I see.
And you'll be surprised you'll not get 1810 so easily.
Yeah. Okay. That's
Thank
a sad story. Thank you so much, and thank you for sparing your valuable time for the session. And most of us really had an eye-opening session today. Thank you so much, Dr. Sakthivel, and thank you all for the patient listening.
Thank you. Thank you, ma'am.
Thank you, sir. Thank you so much.
Thank you.
Thank you, Suveda ma'am. I'm really humbled that you joined us as a host today. Thank you, ma'am. Thank you so much.
Thank you.
Thank you, sir. Good night. Good night, everyone.
Good night.